Republic of Egypt, Excellencies, dear guests. My answer to your question is that we are starting the 42 million of the... Sorry, I missed the 3 days of the campaign. And now we were 35 and now it's 42. Yes, because every day we are screening more than 60,000 persons. In fact, my speech is very meaningful because we are making links between health care, scientific research and the youth. Why the youth? I need to ask this because all my speech does not revolve around a dream, but rather a reality, something that we can provide to our land, to our continent at the hands of our people, the graduates of the presidential program. The relationship between scientific research and healthcare is interrelated and on a very continuous basis, because we need to identify our needs, then build the databases, and during this 100 million healthy lives campaign we could analyze the data to generate a solutions action plan to improve the healthcare services. And it's a continuous project because we go back to review. The Ministry of Health has taken many steps when it comes to technology transfer and building on scientific research through 3 main pillars. Of course, there are many pillars, but due to time constraints, I need to focus on the most important 3 pillars. Industry. And here I'm referring to pharmaceutical companies, especially HCV drugs and insulin, among with other vaccines. Also, we started a national project, and next year we will tell the success story about plasma manufacturing. Also, digital technology is very effective, and the state is embarking on digitization. We have automated many projects, many services, and now we have distance medicine or tele-med services. Also, innovation. We facilitated all the procedures in order for people to issue patents and to innovate and create. Of course, Zuwayl City, Zuwayl University is a pioneer in this regard. We are working hard with this university, and we submitted the IRP, or the academic research ethics, and the project was approved. We also work with the central labs of the Ministry of Health in order to produce a product to help all the countries of the world to screen people for HCV. Now we are digitizing everything, making all the medicines affordable for 3 months. The cost was $8,000 and now it's $50 with the help of the Egyptian companies. And yesterday I talked with Dr. Francis, who is the chairperson of the patent community in the UN, and drugs patents, with the help of the WHO, could be popularized in order to allow our country, with the vision of His Excellency the President of the Abdel Fattah al-Sisi, could be produced and manufactured. Here today I could confidently say that we embarked on a serious journey for insulin and erythrobutene, and also we produce some drugs for treating oncology. We are accredited by the WHO and FDA to manufacture many drugs locally in Egypt. We have good factories here, and we are partnering with African countries to unify the registration procedures in order for all the African people to enjoy the drugs. We need to share this knowledge because these drugs were manufactured at a very affordable cost. Also, we could register a new drug and treatment for malaria. It was approved by the FDA in the US. It was registered here in the Ministry of Health in Egypt. We have factories whose capabilities is 3 tons a day. This product can be manufactured from the plant waste because it depends on the chlorophyll, and we could spray much of the quagmires with this drug in order to control the spread of malaria and to control the spread of different flies. Also, technology enabled us to conduct many other projects. Now we are working on manufacturing plasma, and we are way ahead in this with the support of the WHO, and we entered into contract with one of the most prominent experts of collecting plasma, and we are working on founding 12 centers for this, and we expect 36,000 of volunteers in order to produce 300,000 liter plasma with its derivatives. What is the role of technology in developing healthcare services? Now I would like to present how digitization in the Ministry of Health helped a lot. We automated many services. We analyzed big data in diagnosis through telemed. The political vision was translated in a presidential decree number 89 of 2017 to found the Supreme Council for the Digital Economy, after which a Prime Minister decree was issued in order to enforce this presidential decree, and we founded a unit for digitization in the Ministry of Health run by a group of youth who are the graduates of the presidential program. And they started with us this system of digitization, especially in the medical insurance part. Digitization means linking data, means data analysis, data collection. We need to have effective communication between service providers and receivers in order to plan the services based on the evidences available. Some examples or some real stories that we worked on. I would like to say that most of these stories are in-house, designed in the Ministry of Health at the hands of the staff working in the ministry. We provided them with a space to innovate and create, and they could do a lot. One use could automate the information of 14 governorates in Egypt, and more than 300 of dairy outlets. This dashboard that we have give us a real-time data about the dairy products in order to have a strategic reserve in this regard. With this innovation, we could increase the coverage to be more than 3 months. Automation of birth and mortality rates, and here we have a kind of integration between the Ministry of Health and Ministry of Planning and institutional reform. The partnership between these two ministries allowed us to automate the data in more than 4,571 offices. The daily numbers we get are very significant and telling. They can help us understand a lot about the mortality reasons, to identify the most vulnerable age groups, to have an overview of the birth rate in which countries is high and why. We also work on big data, and we can analyze this big data to go out or to come up with good studies in order to implement the health plans in the best possible manner. We have this for the medical insurance, we have this for the HCV, we have this for birth and mortality, and for the e-medical record file, the initiative entitled 100 million healthy lives is very beneficial, and this goes beyond diagnosis, screening for all the citizens in order to control one of the most serious disease, as 84% of the deaths are attributed to this disease. Now we have an automated database. We have 20,000 data entry staff are working on this, and they are all linked through one secure system, and all the data for citizens are also secured, and this is a snapshot of the real-time dashboard we have in the operation room for HCV and non-communicable diseases. Here we are working hard to get some indicators upon which we could formulate health plans and strategies. Here we have the data entry clerics, and here we have the staff working in the hotline, in the call center for HCV and non-communicable diseases. This software was designed in-house. A 30-year-old youth designed this. Engineer Haytham Salah designed this software. He visited us. The head of the health sector of the World Bank visited us, and when we had a look on the software, he asked us which multinational company designed this, and we said Haytham did that. And I met yesterday with Dr. Francis, and I told him that under the directives of His Excellency the President, the software and the IP rights, along with the waiting list IP, will be registered in the WIPO, and under the directives of the political leadership, we will make this available as an open source software for the African countries. We could share this software in order to give a hand to these African countries. We can share these successes in order to work together, and many African countries have much to offer as well. Also, the waiting list system had made a frog leap in the second phase. You know, people used to get a decision which we cannot follow up on the implementation of, which now patients can register, hospitals register as well. Now it's a paperless ecosystem, and we are working in the second stage, of course, the treatment of which is done at the expense of the state. Now we have quality control for this system. Also, the automation of the medical insurance has to do with the facilitation of service delivery, and for making sure that financial sustainability is in place. This is the system that we work accordingly. And this is the interface. This is the way we register the data of the Egyptian families. Thank you so much. A last point to make, please, Amr, if I may. I need to refer to the role played by many partners or the line Minister, General Intelligence, Administrative Control Authority. But I need to mention the role played by Africa. The chairmanship of Egypt to the AU can serve as a springboard for all of us. We graduated 311 scholarships and associates from these scholarships. 4 days ago I was in Geneva and I met Dr. Tadros. we went there with one goal in mind. How can we, with the help of the WHO and with the presidency of the AU, can help African countries and exchange knowledge? And this is what he wrote after our meeting. This reflects his thanks to the efforts exerted in Egypt to combat hepatitis C, and he thinks that African countries can learn from Egypt. He praises the extraneous efforts exerted by His Excellency President of Egypt during this campaign. Please, last point to make. Here I want to